Today I have presented in UICC about the contribution of BRCA1 promoter methylation in Pakistani triple negative breast cancer patients. So BRCA1 and BRCA2 are the two major genes, breast cancer predisposing genes if the genes are silenced, and the major reason for gene silencing is genetic changes. So we have identified in Pakistani population the prevalence of about 25% BRCA1-2 mutations. And among these, we noted that BRCA1 mutation carriers have a distinct subtype of breast cancer, which is triple negative breast cancer. So this is a subtype which is very aggressive. Overall, the prevalence of triple negative in Pakistani population is higher than the West, which is 30% in Pakistan, and in the West is about 12 to 20%. So we noted 37% of triple negative breast cancer women harbored BRCA1 mutation, whereas 67% of breast cancer women with BRCA1 mutation only displayed triple negative breast cancer. So there must be another mechanism of gene silencing, which is BRCA1 promoter methylation. So only two studies are conducted from Asia. One is from India, a smaller study on 50 cases, and second is from Saudi. Case it includes cases of 150. So these were smaller studies, and they also included BRCA1-2 mutation carriers, and they did not stratify triple negative versus non-triple negative breast cancer cases. So we conducted the first study of its type in Pakistani population to investigate the contribution of BRCA1 promoter methylation in triple negative and to correlate with the pathological features. Breast cancer is the major cancer in Pakistan. Overall, in the world, about 2 million new cancer cases are being diagnosed, and about 0.7 million of these individuals die from this disease. And there is a disproportionate mortality ratio in developing world, and Pakistan has one of the highest mortality to incidence ratio in Asia. So majority Pakistani women are presenting at an advanced stage and at a younger age. So therefore it is very important to identify or to design a non-invasive assay for Pakistani women so that we could just predict that an individual is at higher risk as compared to another individual. For this purpose, we started a study in our database in a tertiary care cancer hospital, Shaukat Khana Memorial Cancer Hospital. We included 385 breast cancer patients, 131 triple negative, remaining 285 or 240 patients non-triple negative, and 107 healthy controls. All these patients were negative for BRCA1-2 mutations. So we performed methylation sensitive high resolution assay by a system, and we included all samples 3 times and also included methylation standards just to validate our results. And more than 76% of our study population were diagnosed within first year of their presentation when they were recruited, so thereby minimizing any kind of survival bias. So what we noted overall, the contribution of BRCA1 methylation in breast cancer patient is about 19%, and in control it's 13%. When we stratified into different risk parameters, among early onset cases it was higher, about 23%, but even higher in triple negative cases, about up to 30%, then non-triple negative, which is 14%, and healthy control, which was about 13%. And we also noted that though higher prevalence was identified among breast cancer with presenting with the higher tumor grade, that is grade 3 as compared to grade 2 and grade 1. And also PR negative tumors have higher methylation than PR positive breast cancer tumors. But we did not identify any other parameter like age, ethnicity, BMI, parity, ER status, or HER2 status. We did not find any correlation. And then we performed a test of multi-logistic regression model in which we noted that triple negative breast cancer was independently associated with BRCA1 promoter methylation in our population. So in conclusion, this was the largest study we conducted from Asia in which we investigated the contribution of BRCA1 promoter methylation in Pakistani triple negative breast cancer, and the prevalence of prevalence of constitutional BRCA1 promoter methylation was two-folds higher than non-triple negative. So based on these findings, we suggest that this BRCA1 promoter methylation, this is just a simple blood test, could be used as a pre-invasive tool, pre-invasive diagnostic test to predict who is at risk to develop triple negative breast cancer. So in Shaukat Khana Memorial Cancer Hospital, we started BRCA screening back in 2001. We started a project with collaboration of German Cancer Research Center Heidelberg, in which we screened our patients, and we transferred the technology from German Cancer Research Center back to Pakistan. I did my PhD from German Cancer Research Center. Then we transferred the technology to Shaukat Khanam. And in Shaukat Khanam, since 2001, we are conducting patient screening who are at risk in a research-based setting till 2018. So all patients who are at risk, younger age of breast cancer presentation, or those with a familial breast cancer or breast and ovarian cancer or even ovarian cancer, all those patients were screened for BRCA1 and BRCA2. And if a mutation was identified in those individuals, then we offered cascade genetic testing to their at-risk individuals. And everything was performed and offered free of cost. Shaukat Khana Memorial Cancer Hospital supported that study. And based on that knowledge, over a period of last 18 years, we identified some founder mutation. Founder mutations are ethnic specific mutation. If that mutation was identified in one of the leader or founder, it becomes prevalent to the whole of that ethnic group. So we identified there are some specific mutations in the north, some specific mutation in the south, and based off geographic region and the caste, so we could predict what are the possible mutations. So based on that, of our more than 1,000 families, so we have designed an assay including 26 Pakistani specific mutations. So we are offering it as a diagnostic test. So any patient anywhere in Pakistan or even those sitting abroad could get that sample tested, and within 1 week the results are being shared with the clinicians. Breast cancer is the most common invasive malignancy among Pakistani females. It is estimated that 1 out of 9 Pakistani females will be diagnosed with breast cancer. And majority of Pakistani women are presenting at an advanced stage and at a younger age. But there is a 16 months delay. There was a study conducted in Pakistan, in Sindh, so which showed that the patient's presentation with symptoms and presenting to the doctor, it takes 16 months. This is a huge delay. So efforts should be made for the increased breast cancer awareness. So for this, Shaukat Khanam, in every year in October, there is a breast cancer awareness month in which we give talks to the general public and also in television, and there is also a media campaign for the awareness of this disease. This is a treatable disease. The survival rate is higher than any other cancer, but the main thing is if there is any sign, any symptom, so an individual noticed, then she should immediately consult a qualified doctor, not to the quacks or any other person who has no idea about this disease. This is not a contagious disease. There is another misconception in our population that a patient even sharing food that could spread to the another individual. This is not a contagious disease. So, and especially females are the center and the nucleus of any family. So they are really important. So as a wife, as a daughter, as a mother, for the well-being, upbringing of the children and the education of the children. So healthy woman is important for a healthy society, and that is only possible with the increased cancer awareness. Shaukat Khana Memorial Cancer Hospital is offering a free treatment to more than 75% of patients are getting free treatments. So now there are 3 cancer hospitals, Shaukat Khana Memorial Cancer Hospital and Research Center in Lahore. Second one is in Peshawar, and third one will be opened soon by 2025. So all patients, whoever has any symptom, there are free walk-in clinics. They can go to the walk-in clinic for their a checkup, and if there is any suspicion, then the doctor would suggest some test, and based on that test, so patient could be diagnosed, or if the patient is diagnosed, then the individual will get early treatment. If the patient is not having any kind of cancer, then there would be a sign of relief for the individual. Then he or she has no need to worry about.